Bismillahirrahmanirrahim. My name is Dr. Ataul Ahmad Zai. I am a resident of Ophthalmology Department in Ishtar Medical University and Hospital. Today I will introduce you one of the important instrument in ophthalmology. It's called Maddox wing. Maddox wings, it is an instrument used by an ophthalmologist, optometrist and orthoptist to measure the strabismus. The principle of this instrument is it dissociates the two eyes, or it breaks the fusion of the two eyes. From the right eye, you will see there are arrows which is white color, and there are two scales. One is vertical, another is horizontal. With this instrument, we can measure the phoria or also a mild tropia. It has some parts. It's called handle. This is called diaphragm, or also it's called septa. This is called eyepiece. Eyepiece, it is lens holder, or this is called scale. Or there is torsion lever. It's called torsion lever. When we are doing this procedure, first of all, if the patient has any kind of refractive error, we have to correct that. For example, if the patient is presbyopic, you have to give they have to use that spectacle, or if that is not appropriate, you can use his lenses, and you have to correct the near vision of that patient. When you are doing this procedure, that should be at 15 degree or in the reading positions. At right eye, you will see there are this white arrow, or also in this particular Maddox wing that is not present, there is another red arrow. There are two kind of numbering. One is odd, which is 0, 3, 5, 7, 9, 11, 13, 15. And another is even, 2, 4, 6, 10 until 22. What it means? It means that if there is any kind of esophoria, this white arrow will be in front of that. For example, if the patient has this arrow is in front of 5, it means that the patient has 5 prism diopter esophoria. If this arrow is in front of 6 or 8, it means that the patient has 8 prism diopter phoria. Exophoria. This is the significance of that. Another thing which is important that you have to note, if the examiner is asked you that which eye for which eye this phoria is present, for example, exophoria or esophoria, you have to say that in the phoria there is no directions. It can be at right or in the left. Another thing that we have to use, it's called torsion lever. Torsion lever, you can see they have right here encyclo version. If the patient eye is rotated nasally, it's called encyclo version. If the patient eye is rotated to temporally, it's called excyclo version. This is the center. If this is the numbering will be, every number give you 2 degree encyclo version or excyclo versions. So this was a brief introduction of this important instrument. In this instrument, we are measuring the near strabismus or near phoria. For far phoria, we are using the Maddox rod. This is one of the important instrument which will be you can find in the FCPS part, FCPS IMM modules, and also in the MS ophthalmology in the part 2. Thank you from your time, teacher.